Approximately 1 in 100 infants is born with a congenital heart defect, and as a result of significant advances in pediatric surgery and pediatric cardiology care and nursing and adult care, we now know that about 90% will reach adulthood. And that is a major success story, and everyone's really excited about that, particularly patients and their families. In Ontario and other places, though, people must transfer from pediatric hospitals to adult hospitals at the age of 18. And that process is called transfer, that event is called transfer. But it also entails a longer process of transition where young people, so adolescents and young adults, gradually take increasing responsibility for their healthcare management. And that begins in early adolescence and actually continues following the transfer to adult care. So what we're trying to do with this website is provide information and education and help them develop skills to learn how to manage their health care more independently. The goal really is so that patients anywhere in North America can log on to this website and learn about transitioning from pediatric to adult care, and more broadly, really just learning about what it is to live as a young adult with congenital heart disease. By including these other centers, we also allow patients transferring to those 5 centers now, and certainly we'll have more joining us, to become more familiar with their adult healthcare providers. And we know that's a big thing. If you think about it, we're talking about people born with heart defects. They've had the same hospital, the same medical providers for 18 years, and they love their pediatric teams, and they're incredibly grateful, and they have this great relationship. It will take a while to develop good relationships with new providers in the adult setting, so by introducing the team ahead of time, we think we can make that transition a little bit easier. We want young people to know the name of their heart condition, and that way when they present to new healthcare providers or perhaps even to an emergency department, they know the name of their heart condition, their heart defect. We also want them to know the importance of lifelong medical care, because unfortunately a lot of people are lost to follow-up. So they, for a variety of reasons, stop coming to specialized congenital heart disease care. When they do present later on, they're more likely to not be getting optimal medical care. So we want to keep them in the system. So we want them to know the importance of lifelong care, number 2. Number 3 is we want them to be prepared to live as rich a life as possible with their heart disease. So we want them to learn about if there are any considerations for exercise or family planning or thinking about school and a career. We want them to be as prepared as possible to become adults with great lives. One of the exciting things about this process is it was a real collaboration between pediatric and adult providers. So adult providers here at Peter Munk Cardiac Centre and pediatric providers at the Hospital for Sick Kids, Hospital for Sick Children, worked together to develop this website. And the nice thing is it received funding from Labatt Family Heart Center Innovation Fund and the Peter Munk Cardiac Centre Innovation Fund here at UHN. It would not have been possible without those Innovation Fund dollars, so we're incredibly grateful. And it's a really nice way to highlight the compassion that we have for our patients and our desire to be innovative and patient-centered and provide information in a format most appropriate for them. For a 1-year period, we invited all patients transferring from the Hospital for Sick Children to the ACHD program here at Peter Munk Cardiac Centre to be part of a research study. We sent them a baseline survey, then we gave them web access for a month, and then we had them do a follow-up survey. And what we learned that is over 90% of the 17-year-olds who logged into the website thought it was helpful, it was easy to use, it gave them information they could trust, and that's really important because, as you know, there's a lot of sketchy information, medical information on the website. So it gave them information that they could trust was reliable, and over 90% thought that it should be available to all patients transferring from pediatric to adult care. Well, we know that a lot of patients actually are, have lapses in care, and they can have those in the pediatric setting and in the adult setting. But they're actually at most risk right around 18, 19, 20 years of age, right when they are making that transfer from pediatric to adult care. And researchers have looked at this, and it turns out that when they eventually do present for care, they're more likely to have a new diagnosis or need urgent diagnostic testing, or are more likely to not be on the right medications or have had the correct procedures. So we know that the best way to provide optimal care is to have them keep coming back for the regular visits. And you know, it's important for us to let patients know, even if they're feeling well, we still want them to come back for their appointments, so that when challenges or problems do arise, that we can start managing them as soon as possible. One of the things I often hear is, you know, I don't know anybody else like me. You know, have you ever met anybody with tetralogy of Fallot or an atrial septal defect or transposition of the great arteries before? And so they often feel quite isolated because although it's the most common birth defect, still they're unlikely to know somebody else with that same medical condition. And they've been dealing with this for their entire lives. So I think one thing that the website does is provide them with information in a youth-friendly format that lets them know that they're not alone with the questions that they have. So whether it's wanting to know about travel or tattoos or school, by looking at the website, they know that these are really common concerns, and they're so common that we created a website just for them and people like them.